what that looks like. Just give me one moment here. Let me just put this code in. About this, guys. All right. A profitable aesthetic injector and someone that's not just only able to create beautiful luscious lips, right, really that smooth forehead, but really able to be strategic and results oriented is what we are after. All right. And to be able to do that, that is going to result in an increase in revenue. So today we want to share with you some of our secrets to not only really getting balanced, beautiful results, but to help the business grow, to create a really thriving book of clientele that comes back again and again. So I'm going to give you about 9 or 10 different attributes of a profitable injectors. And then I want to ask you to look at your team, look at yourself if you are an injector, and really have some self reflection, honest self reflection on if you really are holding yourself to this high standard and what that looks like. All right. So number one is really recommending combination treatment plans, long-term treatment plans, not just being a one vertical or one service-oriented superstar, right? Again, we often see people that they are like the lip guru. That's all they do. It's great and that's beautiful. But, right, there's a full face, right? It's not a full body that you have the opportunity to help your clients with. So, MJ, I would love for you, and I have a couple Diamond Girl consultants that's going to be joining us today. I'd love for you to break down a little bit more on developing really those comprehensive treatment plans and what does that mean, right? To utilize all the tools in your tool belt.
Yeah, absolutely. So essentially, you kind of hit it on the head. People do lean on certain services that they become, sought after for, but a high performing provider will go just a step beyond that. So full facial balancing, or something that they can even give like a special name for, really developing a specialty that ends up becoming synonymous with the med spas brand. So essentially, being innovative in treatment. So not just being the lip girl or, the cheek girl, really being innovative and working with different areas and kind of figuring out how to make combination treatments your specialty, again, being synonymous with your brand, with your med spas brand.
Yeah, absolutely. And the next thing to compound that is, and if you're on my team, you're probably surprised that I didn't say this, like the number one thing, right? Which is confidence, right? Being so confident in your recommendations and a believer in the services and the results that you can provide, right? That you are not making recommendations based on what you think the client can afford. Even if the client tells you their budget, you still don't want to just recommend based on budget, based on what you think they can afford, but based on the result that they told you that they are trying to achieve, right? Confidence is such a big thing that holds providers back from really getting the results that their patients want. It holds them back from meeting their revenue targets and their goals, right? Because they judge a book by its cover. They have money mindset blocks that prevent them from really fulfilling their professional obligation, right? Which is to recommend a treatment plan that is going to get the result that the patient told you that they wanted. And I always like to share a similar scenario of when you go to a doctor because, you broke your leg or you need a new knee or need a new hip, right? The doctor doesn't say, okay, what's your budget? What can you afford, right? He tells you this is what you need to feel better, right? So it's the same thing is that we have to have the confidence as providers to make a recommendation based on the result that they are after, that you know that you can get them with all the different tools in your tool belt. All right, so the next one is that they are a real believer in treatment prep and post-care prep or post-treatment care. And I'd love for Abby, one of our consultants here at Diamond Accelerator, to chime in on this one because I know she's a real believer in this.
Yeah, it's super important. If we're like looking at prescribing, when you're talking about the difference between an esthetician or a medical esthetician, or even working with injectors that don't really understand skin, post-care and our pre-care is so important to set up healthy skin, because healthier skin is easier to treat. It gets longer lasting results, shorter recovery time. So all these things play a really big part in that. And that's really setting up those comprehensive treatment plans. Can they put your complete care plan together from where are we going to start? Not only where are we going to go over the next 3 months, but how do we maintain those results with the medical grade skincare that we need in order to need less treatments over time? And so incorporating that is huge, and educating yourself. It all comes back to education. Are your injectors educated? Can they speak with confidence because they've educated themselves in order to educate others?
Yeah, too often times we hear injectors say, I'm not an esthetician, right? I don't recommend skincare, or that's not my department. And we believe that it is absolutely a part of their professional obligation to educate themselves to understand what skincare they should be utilizing for, prep and post-care treatments. Absolutely, hands down, it's their responsibility to educate themselves, right? And know how to utilize skincare to prolong the results that they're utilizing other devices and services to get the result that they are after. All right, so the next one is that they loop in other providers and departments, right? Again, they don't just view themselves as, all I'm going to talk to the patient about is injectables, right? And I'd love for MJ to share her thoughts and ideas of how to collaborate with other providers when you're an injector.
Yeah. Collaborating with your team is absolutely crucial. One thing that I love to implement in practices is what I like to call meta-assisting. So if you're an injector and you have a down hour, someone canceled last minute, hop in your laser tech's room if she's doing a consultation. Just getting yourself familiar with those patients and answering any questions that they might have, introducing yourself. It's really just getting the patient comfortable with who you are. Maybe they're interested in injectables, but they haven't found the time to come in and consult with you. Med-assist that laser tech in that room. Introduce yourself. What's your specialty? Ask them any questions and really just assist that laser tech. That collaboration is going to dramatically increase revenue and your overall patient retention. They're going to start becoming familiar with more and more providers in your office and realizing, oh my gosh, she was super nice. This might be a service that I was a little bit hesitant to try. I'm worried about pain, cost, provider experience, and she just put my mind at ease for all of that, I'm going to do that cheek filler I've been dying to do. So med assisting in your practices should become a routine at this point. If you have any downtime, hop in your laser tech consultations, hop in your esthetician consultations, or even another injector so that you can collaborate together. So that teamwork is really going to help drive sales and overall patient retention. I love med assisting.
Absolutely. And it really is the responsibility of the business owner and the practice manager to be fostering, encouraging, and really requiring that collaboration between departments, and then teaching them, showing them what does that look like, right? One of our favorite revenue generating activities that providers should be doing when they have a gap in their schedule is not going to Starbucks or checking your Instagram. It's hopping in the other treatment rooms and saying hi and checking in, and just like MJ said, asking questions, right? And having those that collaboration with whether it's an esthetician or a laser technician or health and wellness, whoever it may be, right? To be able to provide your knowledge and expertise on how to ultimately provide the best experience and results possible for that patient. All right, so the next one is that a profitable, top performing injector educates their patient on keeping a schedule, the importance of keeping to a schedule, right? So, and really figuring out what's going to be the best for that specific patient, right? If are they someone that is going to do Botox every 3 months, every 4 months, every 6 months? What is it? And regardless of what that exact date is, they want to say it with confidence and authority, and make sure that they schedule their appointment before they leave, right? I was speaking to a practice this morning, and they had all sorts of excuses of why that wasn't important to them, and that it couldn't be done because, they don't know what they're doing in 3 months. And I said, okay, wait a minute here. How is it that I can go to the dentist 1 time a year, and I'm telling you, I don't think they would let me leave that office until I have my appointment booked out for a year plus down the road, right? So don't tell me that is not a valid excuse, guys, that people don't know their schedule in 3 months or 4 months or even 6 months, right? Because there are many other different types of niches that schedule that appointment 6 months, 1 year, 2 years out, right? So you got to make that a priority, and making sure that you are helping your patients to keep to a schedule, right? And the injector, right, they have to have such confidence of like, girl, you want to see me, right? You want to get on my schedule? Well, you better book now, because if you wait till the last minute, then you're going to have to wait a week, a couple weeks, a month sometimes for some of these sought after injectors, right? I'll tell you another, like my hair and nail gal, like she will not let me leave until I have my next appointment booked, right? So that is not a valid excuse that my patients won't do it, right? They got to check their schedules. So many other niches out there do it. And our clients, our med spa clients, that's something that we really drive home. So the next thing is that a top performing injector that's profitable, they know their numbers. So Abby, I'd love for you to expand a little bit more about what numbers injectors should really be focused on.
Yeah, I love numbers. This is a big one for me, especially in recruitment. So if you're looking to onboard an injector, do they have any idea what their revenue per hour is? What is their retail to service revenue? What is their rebooking rate? What is their average client invoice? Like, do they have any clue? Are they tracking this? Because an experienced injector, is skillful, a rock star injector is going to understand their numbers, and they're not going to rely on someone else to provide this information for them, not their manager. They're going to be tracking this themselves to make sure that they're staying on top of their game, because true rock star providers chase that, right? They're chasing that goal, and they're always looking, how can they improve?
Yeah, absolutely. Okay, the next one is they take before and after pictures, right? And not only do they take the before and after pictures, but they actually use them in their consultation as well. right? So when a person is, asking about a specific treatment or maybe a certain number of vials, right, that they're going to need, because everyone's like, oh, I just want one syringe, just one syringe. And it's like, to get the results that they're after, they need 3, they need 2, or whatever the number is. And so a top injector is not only going to take those pictures, but they're going to actually use them in their consultation to get patients to commit to that combination and or comprehensive treatment plan, right? They're also going to help utilize those patients or those pictures to be able to keep them to a schedule, right? So they're going to show the progression of this was after, let's say, using BioRegen with filler and Botox, right? And this was after the second and the third appointment, to future pace them, right? Of why it's important for them to use, multiple products and or devices, why it's important to, do it in phases to see how the face or the skin is going to react, right? And to keep to that schedule so you can eventually get to that end result that you are after. Another thing that a top injector is going to do is they're going to create content. They are absolutely going to be creating content because they're a superstar. They want people requesting them. They want people to call and say, no, 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 I only want to be on Sarah's schedule, right? They want to be the local celebrity, the sought after person for whatever signature, treatment or service that they are doing. And MJ, I would love for you to share a little bit more about what kind of content they should be creating.
Yeah. This is a big one. We talked a little bit about those before and afters. Are they using those before and afters to build a portfolio of transformational before and after, like a nice little portfolio of that, to increase social proof and really drive demand? I want people calling, and to Caitlin's point, I want to be on Sarah's schedule. These days, people are utilizing Google, but I'm hearing more and more that people are leaning on social media to find their providers. So are they creating educational content? Are they building that transformational before and after portfolio? Are they leaning into trendy content? How well-rounded is their social proof? That social proof, like I mentioned, is going to increase demand, increase patient retention, increase revenue. Are they marketing your med spa by using their social media? Are they creating educational content to inform patients on, whether it's medically assisted weight loss or a biostimulator? Are they educating their patients through their social proof? So creating that content is crucial. And the best tips that I could give is don't scramble. You might look at your social media and say, "Ooh, I haven't posted in a week or 2 weeks. I really need to throw something up." Be intentional about the content that you create. Set aside some time. Think about, I touched on a little bit, having a specialty. What do you want that specialty to be? And really build that authority through your social proof. That's going to be imperative for high performing providers.
Yeah, awesome. Awesome. Yes, thank you so much. Abby, any final thoughts that you'd like to add, that what you really seek after, let's say you are doing, interviewing to hire a profitable, high performing injector? What are some of those things that you're looking for that we may not have covered on today's call?
Yeah, I really look for, when I'm interviewing someone, their training, their certifications. What have they completed? What are they hunting for? Are they open to learning? Are they growing? Is this something that they're wanting to? Going back to what you said earlier, are they, one trick pony? Do they only do lips? Are they only willing to do this? I've had so many interviews lately where they're not interested. They're like, "Oh, I don't use a cannula." And I'm thinking, you've got to push yourself to get comfortable, but you've got to grow. And so I'm always looking for an injector that is either, in the past had the certification, had the training, or willing to really grow into that expertise. And so those that aren't afraid to learn and grow in the industry is very, very important.
Yeah, hungry to grow, not just
Hungry.
not afraid to grow, but really hungry and to grow, and that they are seeking out opportunities themselves. They're just not waiting for their boss to say, "I'm going to send you to this conference," right? Because there's so much. I mean, there is free to low cost education out there that's absolutely amazing in today's online course world, in YouTube, right? And so we're looking for that in addition to, of course, what additional trainings have they invested in themselves, or come forward and ask, their boss, their manager to, support them in their professional growth as well. Yeah, great idea. MJ, any final thoughts that you would like to add?
Yeah, Abby really summarized it beautifully for a really high performing injector of what we're looking for. But just in addition to that, I'm looking for someone who is a team player and someone who is growth minded. Are they a lifelong learner in the industry? Are they coming in thinking that they know everything top to bottom? That's always a big red flag to me. This is an ever growing industry. You need to be a lifelong learner. There's something new coming out every month, it seems like. So are they educating themselves? Are they looking for advanced trainings? But aside from that, are you a team player? Are you willing to med assist? Or are you someone like the example that we gave? If you have a down hour, are you running to Starbucks or getting your toes done? Or are you actively looking for opportunities to med assist with your team? Are you, if you see a need, maybe there was a mix up with like the cleaning schedule and there needs to be dusting and you have a down 30 minutes. Are you willing to roll up your sleeves and take care of that? Or are you going to lean against that because you feel like that's not in your job description? So I'm looking for a hustler, a team player, someone who's actively seeking out advanced skills. And, really high performers are going to do all of those things without, like Caitlin said, your manager even asking. They'll do it before it's even identified as a need. So that dusting, that would have already been taken care of. She would have handled that.
I love that. I love that. So if you are watching this video because you are an injector, I really, challenge you to ask yourself, are you doing all of these things? Where is there opportunity for you to do more and go deeper or potentially add some of these new things? If you are a practice manager or you're a business owner, I encourage you to share this video with your injectors and schedule a follow-up conversation to see, where the two of you can come together to support one another's growth, right? Because when you invest, time and energy into your injector, it really can make a huge difference in the growth and profitability in your business. And I would also challenge you, business owner, to raise your expectations of what your injectors should be doing. It's very few and far between. We have some business owners that they're like, oh no, like my girl, she just, does, 20, 40, 60 units of Botox and sends them on their way. And they're okay with that. They accept that. And, I'm here to challenge you to say is that you got to raise your ceiling. You got to raise the expectations of what you're looking for from your injector. And if you're in the position where you're adding to your team, or maybe you're adding injectables for the first time to your business, again, we want you to raise your ceiling and not think that, oh, injectables can't be profitable. It really is just a gateway for all of my other services. Because when done properly, injectables can be very profitable. But you're right, if you're just given 20 units and sending them on their way and twiddling your thumbs in between, turning over a room, that's a very hard way to make a living for everyone involved, right? The injector's not making enough money, right? They could just stay in the hospital. The business isn't making money by the time they pay that high consumable and that high wage, right? But it can be very profitable when done correctly. So we got to first raise our ceiling, raise our expectations, and then, peel back the layers to see where the opportunities are, because they are there, I promise you. All right, we can go ahead and open up the floor. If anyone wants to put any questions in the chat, we can open up the floor for any questions. It can be related to a profitable, high-performing injector, or really anything at this point. You have the lovely Abby and MJ and myself at your whim. So if there's any questions that you guys would like to put in the chat, we'll take those now. But otherwise, we can go ahead and wrap up, and be sure that you are really thinking hard about where you can continue to grow and improve, right? So if you're an injector, there is so much opportunity. Things change so quickly that you really, to be an A player, have to keep your pulse on what's happening in the industry to provide the results that your patients deserve, to take your unfair share of the market and new patients coming in and really earning the trust to keep your existing patients and not get them lured or away by some Groupon cheap offer, but really they stick with you because of the great results, of your great expertise, of the great relationship and trust that you have built with them. So, all right, guys, thanks for joining us here. If you like this training, make sure that you share it with your team or another med spa that could benefit from it. And we'll be back here next Wednesday, same time, same place. And if there is a specific question or topic that you'd like us to address, feel free to share that with your consultant, and we'll be sure to add it to the lineup.